resident in Lee County, New Mexico, who passed away tested positive for the measles and was unvaccinated. But it has yet to be confirmed if measles was the official cause of death.
And with the number of confirmed cases still at 159 here in Texas, the Lubbock Health Department says it's been good to see around 200 people get the MMR vaccine. KLBK's Maddie Powers has more for us. Maddie?
Matt, the Lubbock Health Department still has their vaccine clinic set up for anyone who's needing the MMR vaccine. And Public Health Director Catherine Wells tells me while the clinic has been open for about 3 weeks now, that there was an uptick in people getting vaccinated after the unfortunate death of that school-age child just last week.
I think the last number was around 160. We're continuing to add cases every day.
As the measles outbreak continues to spread across the South Plains, local health officials expect those numbers to grow. But thankfully, they've had over 200 people get their MMR vaccine since the outbreak.
And that's above what we would normally see in our regular vaccine clinic.
Contrary to what many might believe, the Lubbock Health Department does not offer any type of MMR boosters.
Well, there isn't really a booster for measles vaccine. You know, we've talked a lot about boosters during COVID. The MMR vaccine's one of our most effective vaccines. 2 doses is actually like 97% protective from measles.
Wells says using vitamin A is something that mainly hospitals give to patients with measles, but not as a solution, which doctors say is a myth spreading online.
The CDC and from the World Health Organization is hospitals administering a high dose of vitamin A. With this recommendation, I don't want to see people running out to the drugstore and getting extra doses of vitamin A to be given. It's not a preventative treatment.
And for the little ones who are too young to get the first dose of the MMR vaccine, they may actually be able to get a dose earlier than expected.
So children that live in one of the counties of the outbreak, they're actually recommending that the children get an MMR at 6 months. The one caveat with that is that if they get their vaccine early, they're not going to have a strong enough immune response, so they're still going to have to get 2 MMR vaccines. That's called like dose 0, and then you still need dose 1 and 2.
Wells tells me that CDC officials are here today in Lubbock to work on data analysis and predict when the outbreak will peak.
Interesting, Maddie. Thanks so much.